While this program is not the first of its kind, this is how it works at the Dallas County Jail.
I do the screening for their criminal history background to see if they're eligible for our program. As their attorney, I had to make sure that they understood all the conditions that they would have to follow if they were to participate, and explain to them what the outcome of the case would be if they were successful or if they were discharged from the program.
In this program, it's what's called a Divert program, which is a form of supervision, but it's not probation. The people are not on probation. And so what I do in this program, I see the people in the jail holdover in the mornings. I interview them, making sure that they have the correct diagnosis. And so once I interview them, then I contact the case managers, assign a case manager to work with them if they want to do our program. And that's the person who works with them on a day-to-day basis.
I work primarily as a caseworker. We do work with the court to provide the divertees with treatment. And also we provide information to the court regarding how the clients are doing in the community, if they're participating in their treatment, if they are progressing, if they're not progressing, if they're participating in their recovery from drugs and or alcohol, taking their medications. So it's part social work, helping provide the client with basic services, but it's in coordination with the court.
I interact with the clients. They come and see me at least once a month. And so part of the whole program is designed around having judicial monitoring. The theory behind it is that, you know, they have an authority figure that is involved in their life that they have to report to, that hopefully they can bond with, and so therefore they have someone looking at their progress and monitoring them in a positive way.
And then I came before Judge Wade, and she gave me a chance at this 6-month divert probation. And so I accepted it. I was ready to do something.
Although the program is solid, there are still improvements that can be made to further the program's success.
And there's just not a lot of beds out there for alcohol and drug treatment. And so hopefully we can get them, you know, get more money into the program and get more beds for them and get more services for them.
We have a lot of clients who are in jail, who come to jail and they're homeless. Sometimes it takes a while for us to get them somewhere to stay. When we're trying to get them into the program, if they find out that they have to stay in jail until we're able to get somewhere for them to live, they don't want to do that.
There are a lot of people in need, but we're finding that the major component that makes it difficult for us to make sure that everybody's successful is that housing component. Because you can get somebody, once you get them in and get them on their meds, they're fine, but if they have to go out and live on the street, then it's difficult for them to come to court, difficult for them to do the kinds of things that they have to do. If we could really get more resources in terms of housing, I think it would tremendously benefit this program and we would have more success stories.
While the program continues to grow and improve, there are many success stories after graduation.
We've been able to get families back together, women who have come in the program who have lost custody of their kids, people who have changed their lives around in terms of not using drugs and steady on their medication, going to school, holding employment and holding employment for a significant number of time. And the major success stories are those where people don't keep coming back. To see people change their lives around and then become contributing members of society helps not just you and me, it helps society as a whole, not just their family members. It's just tremendous to see people change their lives around.
I became willing under Judge Wade's mental health court. I take psychiatric medicine, and I decided to be willing to surrender. And I've done real well. This was, it's been 1 year and 2 weeks now. So I'm really pleased with the progress. It's an everyday, recovery is every day, forever.
Thank God, and two things, you know, stay sucker free. What I mean by that is, like the lady said, choose your friends, you know what I'm saying? And main thing, don't panic like you Titanic. Real, you know.
We had a young man who was actually living under a bridge who completely turned his life around once he got involved in this program. Got into the program, got on his medication, got some substance abuse help because he was having difficulty with drugs, He's now living a very drug-free existence. He's on his medication, he's in school, and he's working.
Today, I am so excited because this is our biggest graduation I think we've ever had, 10 people. So
It works. It really works, and it's a wonderful program. It's the happiest I've been in a long, long time, and I'm very grateful for that.